Welcome back to Good Girls Gotta Heal, the podcast where we learn to release the weight of childhood trauma and step into our most authentic selves. It's time to ditch that good girl mask and embrace a life of ease, compassion, and genuine connection. Join me, Megan Walsh, holistic trauma therapist, and let's embark on a journey of healing and self-discovery together. Let's dive in. Hi there, everybody, and welcome back to another episode of Good Girls Gotta Heal. I am Megan, your host, and today I am joined by a very special guest. Today we have Dr. Kerry Makin-Byrd here with us, and Dr. Kerry has an amazing new book out called Start Here, and I know it is going to resonate with all of you listening into this podcast. And I want to just do a quick little intro to Dr. Kerry before we welcome her here and dive in. Dr. Kerry Makin-Byrd is a clinical psychologist and noted burnout and well-being expert who translates science into practical nonfiction. A burnout survivor herself, Dr. Kerry is the author of the memoir, The Ballad of Burnout. She is based in Wellington, New Zealand, and divides her time between writing, providing trauma therapy, and mentoring doctors and therapists. Her favorite types of rest are cold swims with her family and cackling with friends. I love that. I love that. We all need to talk about our favorite kinds of rest.
Right?
Wow.
Yes.
I love that so much. So on brand. So thank you so much for being here.
I'm happy to be here. Absolutely. Thank you. As you said, Megan, before we hit record, it's so lovely to connect with people who are on a similar mission and to talk to all the listeners who are all on similar missions
This mission.
to do their own work. Right? And
Yeah,
continue to
right.
heal and grow and navigate an
Mhm.
incredibly challenging, but also incredibly beautiful life.
Yeah. Oof. Isn't that the truth? And you know it as we resonate in doing this work, right? I know that for us in doing this work in being clinicians who support others through this work, and then both of us writing about this work now, because Kerry and I we share a literary agent, and so grateful that that is how we are connected. You know, there's so much self-reflection, especially in writing, right? As I am in it and writing now, it is such a powerful part of the process to bring all that we do every single day into narrative writing form. And I of course want to hear so much about what informed Start Here and the Ballad of Burnout, but I would love to hear more of your origin story to kind of orient our audience to you. I have so many questions, so curious how you ended up in New Zealand, and just want to hear the pieces of your story that you are willing to share, kind of as to how you got to where you are sitting there today.
Absolutely. Okay. So I grew up in outside a stoplight town in Pennsylvania.
Wow.
And come from farmers and miners and pastors, and on my father's side, new immigrants from Britain.
Mm.
Um, and always knew that I loved psychology. Was very interested in how humans work and how I think I was both terrified and intrigued by the amount of pain that humans could
Uh,
feel, and
uh-huh.
also how could we help? Like how I
Yeah.
remember
Yeah.
even in high school and college and then in graduate school, having this question of, I remember you saying in a previous episode, highlighting kind of the intergenerational transmission of trauma and violence and suffering, and seeing that as such a significant public health issue and place we could intervene, place we could just help ourselves and
Yeah.
others.
Oh, yeah.
And one of the things that really characterized the first chapter of my career as I tried to answer these questions, first as a researcher and then as a policymaker within the Veterans Health
Mhm.
Administration, one of the things I was really struck by is I was attracted to those slightly removed professions because I didn't yet have the skills to do the clinical work in a balanced, sustainable way.
Sure.
So I would, across the first chapter of my professional life, I would have these incredibly rich clinical years where I felt so fulfilled by the work I was doing,
Yeah.
working with new immigrant families, highly traumatized, multiple kind of generations of under-resourced families. And I think I couldn't make sense of how can I feel so enriched by this work and be experiencing what I didn't know at the time was vicarious trauma and real work burnout. And so if you look at my trajectory, I'm always in the trauma, violence, burnout space. But
Yeah.
in
Yeah.
terms of the one-to-one work, I'm coming in and out. So as I entered kind of the second chapter, as I
Hmm.
became a wife and a mother,
Yeah.
and felt so I think at some point I got very clear, okay, I want to figure out a different way to do this because this high and low,
Hmm.
there must be a different way, right? There
Yeah.
must be a way to
Yes.
do this.
So true.
So then in the second
Yeah.
chapter of my life, I got really interested in, all right, does the science and what
Hmm.
do contemplative practices teach us about how we can do work that is incredibly mission driven
Mm,
and do it in a sustainable way where you have the rest of your life as well. And that's what I mean. In my one-on-one work, I do a lot of work with therapists and doctors and people in the medical profession now. And
yes.
that's something you hear over and over. This is my mission. I want
Yeah.
to serve and
And
I am so crispy.
yeah. Oh my
How
God.
do I do this? Right?
Yes. Oh, I am resonating with this so deeply because the first chapter of my work experience was working in a pediatric hospital for 6 years and
Yes.
so much vicarious trauma. And I remember, and of course, I was, in a therapist capacity. So I did have supervision. I did have support, right, where we were talking and processing the content that we're witnessing and absorbing. And I always found it so striking that for nurses, doctors, right, PT, OT, speech, everybody, that they had no emotional support system in place inside the hospital setting to process all that they were witnessing and seeing because I mean you get burnt so fast, so incredibly fast. And so, yeah, it is so necessary. It is so important to have that support and to find that balance. And I remember being a part of a team that actually was trying to bring that into a space, especially to debrief, post any especially traumatic losses or cases or dynamics, like trying to bring that in because otherwise how do you absorb that with nowhere to go? It absolutely is going to completely impact your energy, completely burn you to a crisp. And I'm so curious based on the research and the science, what should we know about burnout? And even especially maybe if you're not all the way there yet, what are some signs that you are, inching closer towards it? What should we be aware of?
So I first I'm going to talk a little bit about all right, what are some of the signs? And then what do we know is useful? So in
Sure.
terms of the signs, what we know after there are absolutely lots of more extensive measures and assessment tools for burnout. And the bottom line is that most people, if you ask them, do you feel burnt out? Lori Dolan has a lovely one question scale that anybody can
Hmm.
use in their practice or just for themselves. And I'm happy to send that on as one of the resources.
Yeah. Oh, I love that.
But the important thing is most people know. They know.
Hmm.
And what
Yeah.
I say to people is the signs for yourself are usually, are my emotions much louder and more significant than I'm used to?
Hmm.
Or are they really numbed? Am I feeling
Yeah.
much more than I expect or much less than I expect? Am I noticing another level of harshness or intensity to my thoughts? So, for example, one of the signs that I am in the kind of yellow zone is when I'm on a Zoom meeting and I think privately to myself, I will throw this laptop out the window. Or another thing that people will talk about is noticing others who are taking rest, who are investing in self-care, and feeling angry that those people are making boundary choices or are not feeling the impacts in the same way we are. So
Yeah. Oh, yeah.
I like to think about it as the stoplight model works really well, right? Green, yellow, we can add in orange as we're getting close to red.
Mhm.
And
Yeah.
what I've seen be useful on a team level is having a shorthand for communication. Where are you today? What color?
Mm. Yeah.
And that can be a very brief way among time poor medical teams and settings to just talk about we are in challenging roles in highly stressful environments. We can acknowledge that. And how can we quickly check in with each other? Where are we?
Yeah.
And then
Yeah.
sometimes you are at a yellow, sometimes you're at an orange. And what
Mhm.
does good care and doable self-kindness look like when you're at an orange? That's different than when you're at a green or when you
Yeah.
have the day
Yeah.
off, for
It's so
example.
true. Right.
So
Right.
those are some of the signs.
Mhm.
It's when things feel different. And then what do we know works? And this is something that I was very struck by. This is true for burnout literature, but it is also true in my book, Start Here, A Practical Guide for the Overwhelmed. One of the big themes in the science is there are things we can do on an individual level. We absolutely have agency. And I do think that is a place where research that is very focused on individual skills and self-help that is very focused on you have all the power doesn't serve us well, actually. Because the
Right. Right.
reality is there are things we can do, and telling people to swim wildly upstream when there's a strong
Yeah.
river yanking us down is
Yeah.
unfair.
Yeah, absolutely. Absolutely. There is, I mean, all so wise and so important that self-awareness of reflection of where am I today, right? What do I need? How can I have some agency and control over the choices and decisions that I make? And of course, examining the system, right? And does this system support me or am I set up to fail? And, I mean, we could probably examine this on so many levels in our world today. But let's say if we are zooming in to someone who, and this, I hear this so much, right? You're working for a company who you are just literally worked, into the ground and just
Mhm.
there's no time and space and they're not changing above, right? Like the system isn't changing. What would you say to someone who is inside of that kind of culture?
Yeah. Okay. So I would suggest I'm going to use the template that I use in the
Mm-hmm.
book.
Mm-hmm. Love it.
So in Start Here, one of the things I did is I looked at over a century of science on psychology and behavior change and prevention and positive psychology science. And I distilled down what are the most impactful lessons about things we can do in our lives. And I distilled it down to a 3-step approach, which is Soothe, Transcend, and Move. And the book is a cookbook of all kinds of
Yeah,
different
really is.
recipes about what are different ways to soothe, different ways to transcend, different ways to move. So if we're using this specific example, which my guess is resonates with so many people, and absolutely, I mean, it resonates for chapters of my life, thinking about clients and friends. So the simplest one is long, deep inhale through your nose, pause to feel fullness of the breath, and then an even longer exhale. That is the light touch, brief version. The book has a lot more options because realistically, sometimes a deep breath we need more than a deep
Yeah,
breath.
it's true. It's
Right?
true. Yep. Totally.
But the
Totally true.
key For someone who is in a work environment that is incredibly draining, even though it feels like you have no time and energy, what I would suggest is realistically, if you are going to use discernment about what you can change and where you have agency, step one must be kind of calming your body and getting back into your frontal cortex. So, how do we stay? How can we soothe? So then we can think much more broadly and creatively. So, soothe ourselves first. Then, one of my favorite elements of Transcend is I call it clear seeing. I stopped using the term acceptance in much of my work because sometimes acceptance can come with baggage, and there are things that we don't want to fully accept, or sometimes acceptance sounds like submission or giving up.
Mm-hmm.
Like,
Sure.
well,
Sure.
you just
Yeah.
just accept this miserable job. You just got to deal with it. You got to, I come from British grandparents, and
Mm-hmm.
I'm lucky to live in a country right now that has a solid British element of stiff upper lip. You
Mm-hmm.
carry
Yeah.
on. So,
Right.
setting aside this idea of acceptance as submission, and instead a real clear seeing about, all right, what is unmovable right now? And if I was being creative with a really light touch, where may I have the teeniest bit of wiggle room?
Yeah.
What we know in the science and what I hear regularly from lawyers and executives and surgeons and people in incredibly high pressure roles and mothers working 3 jobs across many time shifts is that they are regularly surprised by, I thought I had no agency. I thought there was nothing that could change.
Uh-huh.
But when I started really small experiments, so that's the final step, move, there are teeny places that I can make adjustments.
Mm-hmm. Yeah.
That answer your
Yeah.
question?
Oh yeah, that really does. And I love how this I feel like this model, right? This three-step approach, it's like it's everything. It goes so deep because this is really like right the trauma healing, that we always talk about on this show. It mirrors that, right? It mirrors that process of learning to reparent yourself, right? To soothe your body, ground your body, gain awareness, and then figure out, okay, what do I have? What do I have autonomy over? How can I now be able to speak for myself and for my needs and put them out there instead of waiting, right, for the other to change or for the other to become more attuned and present to me? How can I attune to myself and actually make those steps? And it's dawning on me as we're talking about this, like here I am. I work for myself. I create my schedule. And I actually just had some conversations recently about like, man, I really do need to change the hours that I work. And like I'm having this conversation with myself of like, you can't possibly do that because it is as it is. You can't change it. But then there's the side of me that's like, yes, I can. I can change it. But then there's still a side of me that's like, oh, it's gonna be too burdensome, right? To move people. And I'm literally having this, right? I know I have full agency, but it just shows how deeply rooted it is, especially when you're good, right? And like everything's fine right now. So why would I shake it up? Why would I risk somebody being upset with me that I have to change their slot? And I name this because I want to model that this is hard, right? Even when you have the most agency over your
Mhm.
schedule, it's really hard to take that step, right? To move when there is a risk of like, oh, how is it, right? How is it going to be received? What happens? And I know that I did a shift of schedule maybe a few months back where I'm no longer working like later than in the evenings. I was doing a couple evenings and I was like reflecting on like, wow, oh, it feels so nice that I don't do that anymore.
Mhm.
Really, I really am so glad that
Yes.
I don't. But again, that all of this can be happening at the same time. We can know what we need and what's best for us. And sometimes that move, that acting on it can bring up, so much stress or a hesitation because it feels like a risk, right?
Yeah. Do you mind if I build on that a little
Yes.
bit? Does
Let's
that
do
feel
it.
all right?
Yeah. Yeah.
One, I so resonate with that. And
Mm.
I am sure that we could have a whole separate conversation about it is an incredibly beautiful paradox, isn't it? That we, both of us, right,
Yeah.
are
Yeah.
self-employed. We are our own bosses. On one level, we have freedom and agency about
Yeah.
constructing our life. And
Yeah.
yet we feel all the same pressures. And I don't want to speak for you, but I know for me, one of the old stories or whispers that comes up is don't make it uncomfortable for anyone else.
Mhm. Yep.
You can, what's the right word for it? It's not as extreme anymore as you're not allowed to have needs or you're not allowed to have wants. But I would say now I can feel the charm of, well, I
Mm.
can tolerate it. I would much rather
Mhm.
be a little uncomfortable than make
Yeah.
anyone else uncomfortable. And
Yeah.
that
Of
absolutely
course.
shows up in
Mhm.
scheduling, in billing, in so
Yeah.
many ways we construct our work,
Totally.
right?
Yes,
Yeah.
yes, absolutely. And I am right there with you. I know my story is around if you do this and it makes them uncomfortable, then they're going to leave you. Like that has
Yes. Oh,
always been in my,
abs-
I've done a lot of therapy on this since becoming a practice owner. And it's been so hard, right, to look at and to face. And then I know that this feeling always comes. What's wonderful in having done it so many times is that this feeling happens and then I make a shift and then, right, everything elevates, right, to the next level. And right. And I grow in the way that I'm meant to grow. And so I love now that even though this feels like scary and historic, the evolved version of me knows that, oh, this always comes before the next leap that you need to make.
yes. And I think that's it, circling back to one of the first things you said a few minutes ago about the reparenting. And the
Hmm.
way I know you and I both talk a lot about for all of us who have had challenging childhoods, which frankly is all of us,
All of us, exactly. Yep, it's true.
how do we show up as the mature, loving, compassionate adult for ourselves? And
Hmm.
that
Yep.
being able to be the parent for ourselves
Hmm.
that says, I mean, that's such a beautiful example, Megan, of this happens. Yeah, sweetie, this
Yeah,
always
this
happens
happens,
before we
right?
make a big change. We feel,
Hmm.
and I,
Yeah.
I have noticed that that came, I didn't expect it, but it has come out in the writing process as well for me.
Yes.
And it's interesting. I've heard other writers talk about this as well, that as we learn,
Hmm.
fear is a piece of the process as opposed to any sign that we are about to be alone or unloved or
Yeah.
unsuccessful.
Yeah. Yeah. Yes. Oh, that I'm holding on to that and I am putting that into the version of me who gets very stuck in the writing process or, has any like imposter syndrome as I'm writing of like, oh, this is terrible. This is not going to come
Mhm.
together. Oh, I'm so
Yes.
overwhelmed. I have so much more to go.
Yes. Yeah.
Yeah. No, fear. Okay. Fear is part of the process. This shows up. This is normal, right? It's normal. You've
Absolutely.
got it. You can keep going, right? And it's not going to be perfect right away. That's another one of it's not going to be perfect on the first try. I know you would love it to be, and it's not going to. We know, right? Every time we know we've got to go back through, and that's okay. Yeah. Yeah. This is so much deep self-compassion, right? Deep, deep self-compassion that we all need. And I know you teach and talk a lot about self-compassion too. So I wonder if you want to open up a little bit of your teachings on that
Yeah, I'm happy to.
too. Yeah.
So I will highlight two self-compassion tips that what I find the vast majority of people find most helpful. So one is learning a clear and pragmatic script. This is based on Kristen Neff's work. It is 3 steps, and the illustrator Catherine for Start Here did this beautiful illustration of someone climbing up a mountain and if you can imagine a climbing wall, the different self-compassion steps are the actual holds as you're going up the mountain.
Yes.
So the first
Yes.
one is just a recognition this is hard. We are in
Hmm.
a moment of challenge or difficulty. The next step is this reaction's human. Of course. Of
Mm-hmm.
course. Kerry, you are talking to someone you admire and respect, to an audience of people who care deeply. Of course, you feel nervous.
Yeah. Yeah. Oh,
It's so
yes, of
human.
course.
Anyone
Yes.
would, right?
Uh-huh.
And then the
Yeah.
final step is what you would say to a dear friend. You can do this. Go slowly. I'm right here with you.
Yeah.
So that many people, especially usually in the beginning with clients, we do it as a letter. We write a letter to ourselves.
Yeah.
And then having a teeny little piece of paper in your pocket with
Huh.
my kind of standard is this is hard. This is human. You got this. And it doesn't need to be kind of aspirational or motivational. It can be, I'm right here. I'm right
Mhm.
here.
Yeah. Yeah.
So
Mhm. Ugh.
that's one piece that people find really helpful. The other piece, sometimes for lots of reasons, when there's a real barrier to being kind to self, one of the sneaky ways around that can sometimes be to picture you as a little kid. Sometimes it feels
Yeah.
tough to
Yeah.
say it to
Yep.
adult you, but saying to little you,
Yeah.
we
Huh.
got this.
Yeah. We got this. We got this. I have a picture of little me right here, which is, I think so. Where is it? Oh, yeah. There she is. Little me dressed up as an adult, which is funny.
Yeah.
Quite a quite a telling photo. But whenever I work from here, she's right there, and I'm like, yeah, there she is. It's okay. And I think this is very like speaking to literally having the picture is something I like to suggest too, because then it's something to interact with, right? It
Absolutely.
makes it
A
so much more
physical
concrete.
touchstone. Yes. Yes, I
Yeah.
so hear you.
Yeah. Ugh. And too, noticing the emotion that comes up around it too. Because I know
Mm,
revisiting our younger selves can bring a whole host of feelings for a whole host of different reasons. And just I love your steps. Of just, it's okay. I'm here. Having that in your toolkit and even having it written out on a post-it note next to the picture is just again a helpful way to have, because it's literally the mirror. It's the mirror that may have been missing, like the voice, the compassionate voice and mirror that you didn't have, to literally have it mirrored to you in just this really concrete way. It's just so powerful, so helpful way to instill that self-compassion on a daily basis. I love that so much. Oh, so good. So good. Yep.
do you mind if I suggest one more technique?
Yes, please do.
Okay, thank you.
Yes.
For people who notice a barrier to focusing on themselves, something that I've also seen be really useful is choosing an image from nature or a kind mentor or an auntie or religious figure. We want to set up a way that you can receive compassion, and it doesn't actually need to be from you. There are I frequently hear from clients who begin our work saying, I hate self compassion. I don't find it useful. It's really
Hmm.
overwhelming.
Yeah. Yep.
Having part of the reason that the cover of Start Here is actually that sun in the mountains
Yeah.
is the whole first chapter of my own self compassion work. What I found most fruitful was thinking about receiving compassion from the sun. And because the sun just gives and it doesn't expect
Yeah.
anything back from us, it just gives.
Yeah.
And it will be
Whoop.
there every day, right? And so that sometimes if you are listening and you are like me from 10 years ago of, no, I do not want to focus on the self, that sometimes can be a little bit
Yeah.
easier.
I love that. I love that. And I love this in what you do and what you do so well and what Start Here does so well is just such practical, structured ways to step into this work in such a light, comforting, way that isn't so scary, right? Like, I love you just to give such practical tools because I have so many clients who are like, all right, I'm done doing this, like really, or it's hard to keep doing this deep dive into all this stuff, right? I really would like something more tangible and practical that I can put into every day. And I think those have to pair together, right? Those
Yes,
have to go together so well.
agreed.
They're so needed. We have to know, we have to literally build our toolkit of ways in
Mhm.
which we can really help to regulate and ground and soothe ourselves and make the movements we need to make in those times where maybe we feel triggered or anxious or overwhelmed or sad. And so I think it is so, this book is just so that, this beautiful, I love that you call it a cookbook because you're so right. So many recipes for how to ground yourself and connect to yourself and be kind to yourself, all in service of, I know, just in service of bringing greater ease, right, to your body, to your mind, which I know is what we're all searching for. It's what we all want. Yeah. And so I am just so thrilled for everybody to have the opportunity to have your book in hand. And I'm so curious, tell me about the release of it, because I feel like it's different depending on where you are, correct? In terms of when it's available.
Absolutely. So if you are located in the United Kingdom or New Zealand or Australia, it is available right now.
Amazing.
And
Great.
if you are in North America, it will be available mid 2026. So we don't know an
Okay.
exact date yet. But
Okay.
my hope is that the plan is I will probably do some US book launch things when it comes
Yay.
out there as well.
Great. Okay.
Yeah, so that's the
Awesome.
range. And
Love
if
that.
people are interested, they could sign up for my mailing list. And then, of course, they would be
Amazing.
notified when it comes out in North
Okay.
America.
Okay. So pre-orders are not open in North America just yet.
I don't think so.
Okay. Okay. All good. Well, that we will get the link to your newsletter. So anyone listening from here, which, and I know we have listeners in UK, Australia, New Zealand. I know we have some there too. So if you are there, you are so lucky that you get to grab it and pick it up soon. And what would be one kind of final intention or invitation that you would like to give the listener, just to take with them on their day as they go about their day today?
Hmm. I'm arguing with myself
I
because
love it.
there is a piece of me that there's a really easy answer related to the book, and
Uh-huh.
I want to be attuned to this conversation as well. Do we have
Mm-hmm.
time for both? Is that possible?
Yes, absolutely.
Great.
Let's do it.
All right.
Yes.
Okay. So the start here answer is soothe, transcend, and move can take less than a minute. It can be in a moment of overwhelm. It can be as simple, of course, easier said than done,
Mm-hmm.
but it can be as brief as long inhale, long exhale, noticing what's happening in your body, and then knowing that you can only do one thing at any given time. Choose your priority for that moment and move forward. So that is soothe, transcend, move. The takeaway in terms of this conversation is you are not alone on this journey. There are so many of us that are,
Yeah.
as illustrated by how many people you speak to and help, Megan, that I think it can be a really soothing reminder that there's a whole community who is very interested and committed to this growth.
Mm. Yeah. Oh, thank you for once again illustrating the way in which we can be deep in our feels and connected and have, right, the practical tools with us. I love that. I feel like that was being able to illustrate both is just the most beautiful modeling of this work and the application of the work in your everyday life. Oh, I'm so grateful to have you here. I know that I'm sure anyone who is listening, you just brought some deep soothing and comfort to their day. You have such a grounded presence, such a calm, like even like the pacing that you talk. I'm like, ooh, I love this pacing. You're just so calm and grounded. So I'm like, I'm taking that in. I need
Thank
I need to
you.
apply a little more of that into to my everyday. So it's so soothing. I feel it. And I know everybody listening feels it. And so please let everybody know how they can find you. And especially too, what you offer even outside of the books too. I'm sure everybody's going to want to know how to find you.
Thank you. Probably the easiest way to find me is just Google my name, Kerry Makin-Byrd.
Mhm.
Of
Mhm.
course, I have a website. I do a lot more kind of personal/professional sharing on Instagram. And
Mhm.
then my newsletter is Dr. Carrie's Love Letters on Substack. Yeah, so that's kind of where you can find me. And then what I'm really interested in doing right now is providing free talks to groups who are interested in learning about burnout, coming back from burnout, compassion practices, navigating the space of we are in overwhelm. What are the things we do as an individual? What are the things we do as a group?
Yep.
So, what I am
Love that.
saying to people is email me and we will
Mhm.
figure out a way that I can speak to
I
your
love
group.
it. Okay. I love that so much. I feel like every hospital in America could use could use a talk from you. That is for sure. And across the world, I am sure, but I
Mm,
think especially
thank
in the uh, around here.
you. Yeah.
Yes, yeah. Oh, well, Carrie, thank you so much for being here. We will have to have you back, especially closer to when the book is launching in North America. I would love to have you back here to talk again. Thank you so much.
Thank you.
Thank you so much for listening to another episode of Good Girls Gotta Heal. I am so grateful to have you in this community. Be sure to subscribe, rate, and review. That helps us out greatly. And we'll see you next time.